right, so how to get your obturator internus, which is an external hip rotator, using a pelvic wand internally. So if you have not been instructed to do this by a healthcare professional, please use this with discretion. If you have questions about this, please refer to your healthcare professional. Okay, so what is the obturator internus muscle? The obturator internus, or the OI, is actually an external rotator of the hip. So it's not a true pelvic floor muscle, although it is a very close friend of the pelvic floor. So here in our bulbar model, we have our pelvic floor muscles here. Okay, and now men, women, everyone in between, we all have the same muscles. Essentially, they look different. So just because this is a bulbar model does not mean that men do not have these muscles. So if we look from the inside here, so this is your tailbone way back here, okay, and this is your pubic symphysis. So if you have carried or birthed a human, you might be familiar with this. This can get a little wonky during pregnancy. Back here we have the rectum, the colon, okay, and so if we look way over here on the sides, we have this juicy little muscle. That's our obturator internus. Okay, so it starts, we can see where it starts actually from the back. These are your ischial tuberosities. These are the bones that you can feel, like your butt bones. Okay, that's where that muscle starts, and then it goes through, and then it goes all the way kind of towards the front here. Okay, it's a little bit hard to see on this model because it's kind of tucked away. We also have something here. We can see the obturator here. Okay, this is the obturator foramen. We also have some other important structures that come from the inside, pierce through that obturator, and go through that obturator foramen. Foramen just means opening in anatomical terms. So we have a lot of foramens in our bones, in our body. Those are just kind of open spaces in between bone for things to travel. So we have some nerve, artery, and vein that come through here that are really important. So if you can imagine, muscle fibers, okay, this tells us the direction of the muscle pull. So when a muscle pulls, those muscle fibers are going to shorten. As these shorten, what this muscle does in particular, it turns our hip outward. So it's an external rotator. So if you were a dancer or did some type of sport, you might know like turnout, right? That is this muscle, okay? Not the only one, but it is one of them. Because of its close proximity to the pelvic floor bowl of muscles, it can get a little wonky and a little janky and a little stuck. So there are some ways to access this externally on the outside of your body, which we usually will palpate when we're doing an external exam. There's also a way to access this internally. You can do this digitally with a finger. You can use a pelvic wand, or you can have a partner help you with their finger. So if you've been assessed by a pelvic rehab provider and you know that you have a tight obturator, either one side or the other or both, you can release this using a digit or a pelvic wand. My pelvic wand doesn't really accurately fit in here, okay, so it's not true to size. So I'm going to show you essentially from a different direction, but you would want to lube your pelvic wand or finger, and how you're going to know that you have reached that sticky obturator is when you are inside, okay? So when your partner is inside or you're inside, you're actually going to have some pressure there on that muscle, and you can turn your leg in and out. So if your knee is bent, if you're laying on your back and your knee is bent, you can kind of go out and in. Okay, you might feel that muscle moving a little bit. You might have a partner apply a little bit of pressure on the outside of your knee, and you kind of try to squish into their hand, and you feel it pop and kind of turn on. If we were to go internally with our wand, we might, for this muscle, want to use the longer end, okay, because we have to get a little bit farther. Now, where is this going and how is this going directionally? So I'm going to jump to a different model. This is a paper 3D model, but we can actually use the wand here. So this model, we're looking at the same thing. Okay, so again, we have our tailbone, and then we have our pubic symphysis here in the front. Okay, these here our pelvic floor muscles. And then over here on the side, we have this nice obturator on either side. So if you are laying on your back to do this, and now you can do this in many different positions, but in order to work out the kind of nuts and bolts of where things are going, I oftentimes have patients start kind of lying reclined on their back with some pillows underneath their back, legs in a comfortable position, maybe some pillows underneath their knees. Another favorite position is with your back flat, your butt's up against the wall or the headboard, and your legs are up. And then you can kind of diamond your legs out. That's a great position because that's going to pull your organs a little bit out of the way because we're taking gravity out of the equation. And then you can just access the muscles more easily. So what I would do if I was laying on my back, okay, and I'm reaching around with my wand, for this particular muscle, yes, again, I would use this longer part, okay, and then I'm going to go in vaginally. So I'm using this side as essentially a lever, okay, so I'm going to go in vaginally, okay, and then I'm going to kind of point almost towards my left hip. So when I flip it over, this is where we are inside. So for me, this is my right hand, left, the tip is pointing towards the left. And then I'm going to find that obturator way up over here. So things you can do while you have this in there, you can do sweeping, okay? If you find a point that feels really sticky, you can apply a little bit of pressure using leverage of your right hand. You can do little circles, okay? You can find a sticky point, apply a little bit of pressure, and then do a windshield wiper with your knee. Okay, you can do just some simple pressing and holding. So feel free to explore with that. Again, this muscle is oftentimes can get really tight when we have pelvic floor dysfunction. It kind of contributes, has a little bit of overflow into pelvic floor dysfunction, but again, is not a true pelvic floor muscle. If you have more questions, I encourage you to see your healthcare provider. Please feel free to leave a comment. And if you need any information on, brands of pelvic wands or things like that, happy to point folks in the right direction. But again, if it's something where you are really concerned and have a very valid concern about this part of your body, you owe it to yourself to get a full evaluation by a pelvic rehab professional. All right, thank you so much for watching.